With more than 20 million Americans seeing their health insurance premiums skyrocket, with Republicans blocking any extension of the Affordable Care Act subsidies. Tonight, President Trump now unveiling what he says is his plan, but there are many questions. Here's Mary Bruce.
As millions of Americans watch their health insurance premiums skyrocket tonight after promising his own health care plan for more than a decade, President Trump finally unveiling what he calls his great health care plan. But healthcare policy experts tell us it leaves more questions than answers.
The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care.
But he did not explain how that would happen. His plan light on details. Just a few paragraphs on the White House website. Officials calling it a framework and a broad direction. How exactly would this work? And can the president assure Americans that this will be enough to cover their health care costs? White House Press Secretary Caroline Leavitt implying Congress would flesh out the specifics.
Congress and the White House are going to work together to put this plan into action.
The president also wants Congress to turn into law deals he has already struck with pharmaceutical companies to bring down the cost of prescription drugs. And he wants insurance companies to be more transparent about their rates. In a new poll, 52% of voters say President Trump has hurt the cost of health care. This month, insurance premiums have soared for more than 20 million Americans after Republicans let subsidies in the Affordable Care Act expire. Astrid Story, a graphic designer and mom from Denver, Colorado, who's battling thyroid cancer, saw her monthly premium rise 35% from $1,400 to $1,900.
How is that fair? How is that fair to a cancer patient that their first thought has to be, am I going to be able to afford the treatment that is going to keep me alive?
And again, David, there are very few details in the president's plan about how much money Americans would get and whether this would cover their health care costs. And all this as more than 20 million Americans are seeing their insurance premiums soar right now. David.
Mary Bruce back with us tonight. Thank you, Mary.